Hello, ladies and gentlemen. Welcome to the PERCOM Online and PERCOM EMS Medical Education Consortium Paramedic Program Preceptor Training class. This is a short presentation, relatively short, that gives you the information that you need for when you have PERCOM students that you are precepting. I know that many of you have done preceptor training programs in-house or with other schools. But each program, each school, has some different variations on the way that they do things. And so the purpose of this presentation and the quiz that follows that you must send back to our clinical coordinator so that she can have you placed into the system is to ensure that you know how to take care of certain things with our students, how to contact us, how to monitor what they're doing, what their objectives are, expectations, and what the expectations that we have of you would be. So let's move on to the show. The objectives. By the time you finish reviewing this presentation and the associated clinical manuals and paperwork that is available either on this site or associated with this presentation for our EMT students and our advanced students from PERCOM, the preceptor should be able to explain the purpose of the internship component in EMS education, know student internship objectives and be able to discuss them, identify the roles and responsibilities of the student, and identify the roles and responsibilities of the preceptor. Also, the preceptor should be able to list the preceptor requirements and qualifications, differentiate between internship objectives that must be completed and those that, because of patient availability and volume, might not get completed, and adhere to the general guidelines of instruction. Students in the field, and that means EMS as well as hospital. Although EMS students receive extensive classroom and even before they get to EMS hospital clinical time, they basically learn most of their profession while they're on the streets doing their EMS rotations. Guidance during the earlier stages of the careers by experienced paramedic and nursing preceptors is a key to quality education of EMS professionals. During their internship, students make the transition from classroom and laboratory to field application of the knowledge, skills, and personal attitudes that will make them competent practitioners of pre-hospital care. Rotations and internship goal. The primary goal of having students rotate in hospitals, clinics, or in the field EMS environments is to produce program graduates who possess the ability to comprehend, apply, analyze, and evaluate information relative to their roles as entry-level practitioners, possess technical proficiency in the skills necessary to fulfill their roles as entry-level practitioners, display personal behaviors and attitudes consistent with professional and employer expectations for those entry-level practitioners, and possess the ability to integrate the knowledge, skills, and personal behaviors required of those entry-level practitioners as needed to deliver effective pre-hospital and interfacility patient care. Key point. Students have successfully completed the hospital rotations and EMS internship when they have demonstrated consistently that they possess the knowledge, skills, and personal attitudes necessary to perform duties as an entry-level practitioner. Other rotations and internship objectives include many things, and these must be completed. Some of these are minimum requirements for total patient contacts, runs, conditions, age groups, and conditions, and these are spelled out in their clinical manuals and objectives. Proficiency check requirements for skills such as vital signs, listening to lung sounds, starting IVs, and other things. Patient assessments, drug administration, exposure control, and many other things that are outlined in the clinical manual and/or objectives documents which are provided to you in this preceptor training orientation program. Because of patient availability, it is impossible that all objectives it is possible that all objectives may not be met and that all skills may not be performed. Nonetheless, as many skills as possible should be observed and practiced by the student. Minimums listed are mandatory. So if there's a minimum, it means they have to meet that. So please give the students every opportunity to complete as many required skills as possible during their shifts with you, and as many of the ones that don't have minimums as well, that you can give them the opportunity to observe, participate in, or perform. Please allow the student to tour and receive an orientation to the assigned area, whether it is a hospital, clinic, or EMS site. Student interns should be oriented by the facility or its designated preceptor. Student interns must be informed on what is expected of them, where they can sit, when they can eat, when they can take breaks, who to follow or shadow, etc. It's really not fair to expect student interns to just know what's expected. Sometimes student interns can cause conflict by something as simple as sitting in the wrong spot or not being given instructions on when they can take a break. It is best to outline everything at the start of the shift. Students also should be allowed to assist in necessary setup and preparation for treatment rooms, as well as cleanup of said rooms if indicated, along with hospital or clinic staff. Put them to work with you. That's part of the job. For EMS shifts, the intern should be able to perform equipment and vehicle checks and any other preparatory tasks. Locate, inspect, and prepare to use each piece of equipment on the ambulance. Locate and operate radio equipment, even though I realize they're not going to be handling operational duties, but they should be allowed to potentially give patient reports or participate in other ways during the call so that they can do this when they're out on the streets later without your preceptorship. They should be able to practice loading and unloading the stretcher with and without a load. If your service has policies preventing the student from helping to do the primary loading and unloading of stretchers with a patient on them, then do it when you're at the station with you and your partner, working with them. One of you get on the stretcher or put monitors and equipment on the stretcher for the weight and let them practice. The student intern should be able to locate and know how to use emergency equipment such as the fire extinguisher, light sticks, and flares in case of an emergency. They should be able to check all engine components, interior and exterior lighting, dash gauges, and tires, just like you do at the beginning of every shift. Show them how to do this, and then as they get further along in their rotations, let them show you. They should be able to assist in response vehicle inventory and inspection, cleaning and maintenance of equipment and supplies. Whatever you normally do at the beginning of every shift should include the student. The intern should also be able to utilize universal precautions of infection control, perform patient assessment including primary and secondary surveys, vital signs including lung sounds and listening to heart tones, patient history, OPQRST on focused history and physical exam, taking a sample history, rapid trauma survey, detailed physical exams, and ongoing assessments. The intern should be able to establish and administer IV therapy, IO, and phlebotomy if they are advanced students. Should be able to observe and assist in the triage of patients. Perform airway management, manual techniques such as manually opening an airway, use of nasal or oropharyngeal airways, oropharyngeal suctioning, performing respiratory support, bag valve mask ventilation, positive pressure resuscitation, oxygen administration, placing, monitoring, and removing alternative and advanced airways for our AEMT and paramedic students. Place, monitor, and remove CPAP and BiPAP with or without PEEP. Should be able to perform CPR, observe and assist in cardiac resuscitation and in trauma resuscitation. Observe and assist in the use of the automatic external defibrillator, AED, and for paramedic students, the cardiac monitor defibrillator. The student should be able to recognize and evaluate mechanisms of injury and or form one or more working diagnoses based on the patient presentation and history and incorporate appropriate management into the resuscitation sequence. This is especially important for our paramedic students. The intern should be able to assist in the treatment of trauma cases, assist with rapid extrication, applying a traction splint, assisting with spinal immobilization when it's done. I know this is not as common in today's EMS environment, but when it is necessary, that means it's even more important that they be able to learn and assist in doing it correctly. Dress and bandaging wounds, assist with penetrating wounds of the chest and abdomen, including pleural decompression for AEMT and paramedic students. Perform bleeding control. Perform musculoskeletal immobilization, and assist with other trauma cases as available. The intern should also be able to assist in the treatment of medical cases such as anaphylactic reactions and shock. Assist in the management and administration of the epi auto-injector or any of the other necessary medications that are appropriate for the AEMT and paramedic student levels. Asthma attacks, assist in the management of metered dose inhalers, small volume nebulizers, and other medications that are appropriate for AEMT and paramedic student levels. Chest pain. Even EMTs assist in the management and administration of nitroglycerin and aspirin, but also the upper levels of medications that are appropriate for the AEMT and paramedic student levels. Chronic obstructive pulmonary disease. Again, medications appropriate for AEMT and paramedic student levels. Congestive heart failure, the same. Coma, the same. Diabetic emergencies. Assist in the use of glucometer. This is all the way down to the EMT level. Assist in the management and administration of an instant glucose product. And for the higher levels, any appropriate medications. Obstructive airway, same thing. Overdoses, whether it's alcohol or drug abuse. Assist in the management and administration of activated charcoal, if appropriate, and other medications appropriate for the AEMT and paramedic student levels. They should be able to assist also in dealing with other conditions, medical seizures, and all kinds of other medical cases as appropriate. The intern should also be able to assist or observe the care of behavioral emergencies, such as acute anxiety, agitation, acute grief or depression, alcohol and drug abuse, anger, confusion, fear, hostile violent behaviors, hyperactivity, hysterical conversion, paranoia, schizophrenia, suicidal behavior, and other behavioral cases which are safely available. Assist in the care of geriatric patients, patients with Alzheimer's disease, immobility issues, osteoporosis, rheumatoid arthritis, senility, and other cases. Pediatric patients, febrile seizures, vital sign differences between pediatric patients and adults or elderly, parental care issues, poisonings, psychological states of age progression, restraint procedures, and that goes for all age groups, signs and symptoms of pediatric illness, and other pediatric cases as well. Assist or observe in the care of obstetric patients, things like APGAR scoring, cephalic delivery, clamping and cutting the umbilical cord, complications of delivery, fetal monitoring, identifying the 3 stages of labor, common complications, and even with abnormal deliveries. And they should assist in patient care involving normal and abnormal deliveries. If you're in the OB department, or labor and delivery department, I realize this is pretty much a woman's world. However, remember that these male students that we're sending to you, EMT, AMT, paramedics, are going to be the ones out there delivering these babies or trying to identify these and even certain gynecological emergencies in the field and managing them. And they may have to manage it all the way through to delivery. So any help you can give them in facilitating their exposures, getting them facilitated to the patients' families and the patients so that they will allow them in the delivery rooms is greatly appreciated, because these are the folks that are working on the front lines and they need your help. Also, with dealing with obstetric patients, inspecting the delivered placenta and umbilical cord, newborn care, including cutting the cord, suctioning, and resuscitation, noting and assisting in medications given to the mother, maybe observing a cesarean section, observe and, if possible, assist with abnormal deliveries, postpartum hemorrhage control, premature infant care, and other types of cases. The intern should be able to observe in the management of cases with legal implications or which require evidence preservation, such as animal bites, abuse, sexual assault or rape, shootings, stabbings, and other types of cases. They should also be allowed to observe and perform sterile techniques and assist as directed, lifting, moving, and patient transfers, patient access, packaging, and extrication, and assist in any restocking, cleaning, or other duties as assigned in the clinical or field facility. The intern should be able to observe and perform diagnostic procedures and tests and review lab results. Review charts for clinical findings, diagnosis, and treatment plans. Monitor and record radio and oral communication of patient information. Document for student records, patient and/or incident information. Assist or observe in any procedure authorized by the attending physician and/or preceptor that will increase the understanding of anatomy and physiology of illness or injury. Students' roles and responsibilities. Students also have specific roles and responsibilities that are necessary for successful completion of the rotation or internship shift. These include, but are not limited to, complete clinical documentation and data entry. This is in their stuff. They are not going to be documenting your charts and should not document the legal record for the facility. But this is for their documentation. Documenting their patient contacts, conditions, ages, care delivered, specific skills performed by the student, ensuring that preceptors evaluate all care rendered, complete the preceptor evaluation data entry, and sign the form verifying attendance. The student should be present during the entire rotation as scheduled. The student needs to abide by facility and program clinical policies and procedures. And the student should perform at appropriate skill knowledge levels and not above those levels. Standards for student conduct. At all times during clinical and field rotations, professional conduct, behavior, and good attitudes will be expected of all students. Students are expected to treat all preceptors, site staff, patients, family, bystanders, and representatives of other agencies or departments with respect and diplomacy at all times. Students are to be evaluated on their affective behavior at the end of every shift. However, students who present themselves in an unprofessional manner or do not deal with situations or others with diplomacy, empathy, and respect are not handling themselves per the requirements set forth for them by PERCOM. Sites are provided with methods to contact the clinical coordinator immediately, and the student also has a preceptor verification form that contains this contact information as well. If the behavior or attitude is something that cannot be adjusted easily or managed during the shift, you may send the student away. But please be sure to contact the clinical coordinator immediately and send a full written incident report outlining the details and facts of the situation that caused you to send the student away. Without this, we cannot discipline or otherwise counsel the student. Serious infractions could lead to course dismissal, so everything has to be in writing factually so that we have what we need to defend us and to manage the student. Ambulance internship. The student must report to the station captain at an EMS service at least 15 minutes before the beginning of the shift. The student should introduce themselves, ask who will be supervising them, and tell the supervisor the scope of their training. The student should ask where to park the vehicle. Ask to look through the ambulance to get an idea of where everything is located before a call. Bring money for meals or a sack lunch. Ask where to leave personal belongings and how to be of assistance during the shift. Students are responsible for doing certain things and not doing other things. It is helpful for the preceptor to have a general idea of what to expect and what is appropriate as well as what is not appropriate. Student dues. All students must come to the site prepared in full student uniform with student name tag and with his or her electronic clinical data documentation device, either a tablet PC or other electronic device for the mobile apps that we use. Paper is not normally used unless the electronic device or internet fails, but the student should have paper forms available just in case. The exception to that is the preceptor verification form that we will discuss later. Tennis shoes are not allowed as part of the student uniform. Students who are out of uniform or without a PERCOM name tag should be sent away, and the clinical coordinator should be contacted immediately. To the right here is a picture of one of our PERCOM students in what looks and how they should look and what they should be wearing. Students must check in with the person in charge and receive a preceptor assignment and general information for expectations for the shift. The student must perform skills and assessments to the level for which the student is being trained only. Students are required to achieve X number of patient contacts, including conditions, age groups, and skills according to their training levels. Without these competencies being successfully completed and documented, the student cannot graduate. The students must function under the direct oversight of the designated preceptor. Students are not allowed to perform patient care without direct supervision and monitoring. That's in bold because we are serious. We really need to ensure that these students are monitoring, and we don't expect otherwise. The student must let the preceptor know if the student is not authorized by the program or educational level to perform a specific skill. The student must document all experiences throughout the shift with the electronic data tracking system that we use, and we do use Platinum Planner for documentation for all rotations. However, students are provided with paper copies of documentation to use in the event the tablet or internet fails. Students must bring their paper copies as well of this and the preceptor verification form and the clinical manual and objectives with them to every shift. If you have questions that might come from one or more of these documents, they should be able to produce them. Students must submit the data by the end of the shift and obtain the preceptor's signature verifying that the student was there for the entire shift. The student will need your name and proper email address that is or will be linked to your Platinum Preceptor account at the beginning of the shift. They should ask you for this. If you do not have a Platinum Preceptor account, then you would need to provide them with that so they can enter you in as a new preceptor. The student must request at the end of the shift, after they have closed out their Platinum account, they must request that you take their device, open a web browser window, and log into Platinum Planner as a preceptor and evaluate the student accordingly. The preceptor should submit and log out prior to handing the device back to the student. Or you can use your own device, that's fine. But we require that the students get this before they leave or they lose credit for the shift. If you are uncomfortable with this process, ask the student for the paper evaluation forms that he or she has been directed to bring on shift for this purpose in case of an issue. The preceptor verification form is always, though, on paper and is an extra form for you to sign that verifies that the student was in attendance as scheduled and that you are the preceptor. Keeping this form on paper was necessary to prevent cheating by students. We found that students found creative ways to create preceptor accounts and evaluate themselves. So we make them also have this preceptor paperwork, this one form, where you are filling it out and signing it. And there is a process by which our clinical coordinator randomly checks in with preceptors to make sure that that is your signature and that you did do this. So if she calls you, don't be worried. It's just part of our random QI process. If the preceptor is not going to be available at the end of the shift, we ask that you designate another preceptor to monitor the student and give that preceptor a full report of what the student has done before you left. That way the final preceptor can adequately evaluate the student at the end of the shift. If for some reason the preceptor cannot complete the evaluation at the end of the shift, he or she should log into platinumplanner.com and evaluate the student afterwards. You should watch for an email from Platinum regarding this issue, or you can create a new account if you do not have one, and then it needs to have the same email address that you gave the student so that it will marry up and allow you to see the student's paperwork. But students have been directed to ask the preceptor to complete the shift evaluation at the end of the shift and before they leave the site, or he or she risks losing credit for the entire shift and all the patient contacts and skills that they did during that rotation. Please help our students by signing and evaluating them properly. Students must assist facility staff with duties other than direct patient care duties as part of the healthcare team for the shift. Preceptors should delegate other duties when patient care is not being delivered, such as inventory, cleaning, stocking, etc. Students may study during downtime if nothing else is needed to be done. Student don'ts. Students should not question the care of a patient in the presence of patients or families. Questions should be directed to the clinical staff at an appropriate time or place, or to the lead instructor or clinical coordinator. The student should not bring friends or relatives to clinical rotations under any circumstances. Students should not eat, drink, chew gum, or use tobacco in any form where patients can see, except in designated areas. Breaks should then be agreed upon by the preceptor or the facility. Students should not argue with a preceptor or any member of the site staff, support staff, other agencies or departments, patients, bystanders, or anyone else during the shift. All communications and behavior should be professional. Students should not perform any patient care of any sort without direct oversight and approval of the preceptors. Again, students who do not arrive in correct uniform attire with a student or school name tag, do not have proper documentation, materials, or equipment with them, or do not behave in a professional manner at all times may be sent away by the preceptor or site. Please contact the clinical coordinator if this occurs with full details at clinicalcoordinator@percomonline.com or by telephone at 903-407-1563. Please keep in mind that the clinical coordinator does work normal business hours. And if you can't wait, if it's really emergent, she will respond to phone calls and text messages after hours. But if it's not emergent, please send her an email to let her know what has happened. That way she has some time off too. Student scope of practice. If a student is asked to perform a duty for which he or she has not been trained, the student must respectfully advise the preceptors that the duty is beyond the scope of training. If at any time a student performs a skill for which he or she has not been trained, the student will be subject to expulsion from the program at the discretion of the medical director, coordinator, and/or program director. Preceptor roles. Take a few minutes to list what you feel are the most important roles for you as a preceptor. The following slides will go over the attributes of each role: role model, teacher, evaluator, mentor. Role model. The preceptor's general behavior, actions, and attitude are extremely important. Students tend to modify their behavior according to what they have seen and heard while they are in rotations especially. And often their performance in the field reflects these influences. A significant portion of our professional behavior is caught rather than taught. As a role model, the preceptor consistently provides care to patients in a safe, competent, and professional manner. The preceptor demonstrates a solid knowledge base of pre-hospital principles and skills, and exercises good judgment and functions well as part of a team. The preceptor communicates well with the patient, family, general public, other healthcare and public safety professionals, and other team members. Preceptor performs well under stress, works within established guidelines of medical protocol and departmental regulations, and maintains and displays a positive attitude toward their job and their department. The preceptor's role is a teacher. Although students entering field internship already have completed extensive classroom, laboratory, and clinical instruction, they still have much to learn about the practice of medicine in the out-of-hospital setting. Students don't come to rotations or field internship to show off what they already know. They come to develop the ability to apply their knowledge and skills in the streets. The preceptor's role as a teacher includes staying abreast of current information and maintaining a good knowledge base, explaining principles of pre-hospital care, instilling confidence, practicing patience, honesty, flexibility, courtesy, and approachability. Teaching suggestions. Establish a relationship with your student early on. Ask about their goals for learning during field internship or during their regular rotations. Find out what he or she considers strengths or weaknesses of their own performances. Example, the student feels very comfortable about taking a blood pressure but still doesn't feel good about bandaging and splinting. This would indicate a place where you can help the student become more comfortable and capable. Preceptors and students should discuss how they best function together. Look for ways to work together that will be easy for you. Remember that the objectives are designed to take the average student from being an observer through participating as a team member to functioning as a team leader. Regardless of how competent a student seems, throwing a student to the wolves by themselves on the first run or patient contact is not a good teaching technique, even if that is what was done to you. Remember, you were once a student too. If you and your partner or fellow staff members who've worked together for a long time. Remember that you may use a large number of established routines and significant amount of nonverbal communication on or during patient contacts or EMS runs. When you have a student, you may need to force yourself to start talking out loud again. Constructive criticism is very important. Don't tell a student he or she did something wrong unless you tell or show the student the right way to do it. You should seriously discuss each run or patient contact. There's something to learn from them all. There are no uninteresting patients, only uninterested healthcare personnel. During patient care calls and during post-contact or post-run discussions with the student, think out loud. Within the realm of what is appropriate conversation in front of the patient, verbalize your thought processes so the student can see how a competent practitioner approaches patient care. Point out comments by the patient or observations about the patient or the patient's surroundings, situations or presentation that were important in guiding your decisions. Remember that to a beginner, everything seems to be important and it's easy to get lost in the details. Part of good clinical teaching is developing the student's skill in picking out what is important. As the student progresses, ask them to think out loud so you can evaluate why he or she is proceeding in a particular way. Never assume that just because a student does the right things, he or she necessarily knows why that action is correct. Reinforce correlations between didactic knowledge and clinical performance. Please never tell a student, I know they teach you this in the classroom, but this is the way things are in the real world. Doing this may cause some students to doubt everything they've learned and resort to practicing by the seat of their pants. If you must do something that is different from practice as dictated by the book, explain to the student afterwards what the rationale for your decision was and why it had to be modified for the patient's specific situation or condition. Avoid any type of criticism in front of patients and families. If the student is making a mistake, correct it as quietly as possible, but do correct it. For example, one way to do this in CPR, count the CPR compressions out loud to slow the student down if the student's compressing too fast. It's a positive way to correct without embarrassing the student. Again, if you and your partner or staff have worked as a team for a long time, there's a tendency for things to just happen on calls. Remind yourself and your team or your partners not to react so quickly to a situation that you don't give the student an opportunity to perform. It's important to remain calm no matter how inept the student seems to be or how frustrated you become with the student's efforts. Reinforce by constructive criticism. Try to show them the right way to do things and try not to yell or talk down to the student. Don't forget to point out the student's positive points. This is especially helpful after giving constructive criticism. Try to end the discussion on a positive note whenever possible. And if the student is simply not learning, call us so we can help. Try not to say things like, "This is your last chance, kid. If you can't get the Band-Aid on right this time, your history." Instead, talk to the student about why he or she insists on putting that Band-Aid on upside down and explain why it's incorrect. Demonstrate what is correct if possible. If he or she still performs the skill incorrectly, call us for help. And if you don't know the answer to a student's questions, don't make it up. Preceptors are not required to be God, but they are required to be honest. Sometimes the best response to a situation where you don't know the answer is to work with the student so you can both find out the answer to the question. Do not adopt the "why don't you look it up and report it back to me" strategy. This discourages students from asking questions and tends to keep them from becoming self-directing learners. If you tell the student you will get back to them with an answer, make sure you do. Remember that students, because they lack the fixed patterns of thinking that experts have acquired, can occasionally come up with brilliant solutions to unusual problems that may not seem immediately obvious to you. When that happens, a good teacher is gracious and praises the student's success. One of the benefits of teaching is that we continue to be challenged by and learn from our students. And don't forget, you were once a student yourself too. Another role is the evaluator role, and it's sometimes the most difficult. It encompasses approaching the evaluation process objectively and identifying areas of strength and weakness and providing constructive feedback. It encompasses verbally critiquing every run or patient contact with the student. documenting student performance at the end of the shift and noting why objectives were not accomplished if necessary, and recognizing the student's right to know he or she is being evaluated, to see the evaluation, and to disagree or comment on the evaluation. Roadblocks to learning. The following have been determined to inhibit or reduce effective learning when instructing the adult learner. Projecting negative feedback. Not allowing students to perform progressively to independence. Assigning learning experiences that are likely to end in failure. Inconsistent or lack of or poor communication skills. Scolding the student in front of others. Demonstrating a lack of patience. Demonstrating an error of superiority in relationship to the student. And the creative clinical preceptor provides an atmosphere of freedom for learning and allows the student to recognize and accept their own failures. Removing roadblocks to learning. It is expected that the preceptor will provide support for the learning process and assist the student in determining their own progress. Additionally, the preceptor can demonstrate the importance of critical thinking by raising thought-provoking questions and by suggesting various alternatives to be explored in resolving problems. Preceptor responsibilities include orienting the student to the mobile intensive care unit policies, procedures, and equipment, or the policies and such of your site. Reviewing with each student the knowledge, skills, and personal behavior and attitudes required of an entry-level practitioner. Using the clinical objectives or field internship objectives provided to the site to guide the student through a structured sequence of experiences, which begins with the student functioning primarily as an observer, progresses to participation as a team member, and ends with the student acting as a team leader and directing the management of calls. Other preceptor responsibilities are assisting the student in obtaining learning experiences that contribute to the student's acquiring the knowledge, skills, and personal behaviors and attitudes required of them once they leave this school. Based on the student's clinical experience and skills, providing supervision which is adequate and appropriate to assuring effective and efficient learning. Providing the student feedback and evaluation regarding their clinical performance that contribute to the students acquiring the knowledge, skills, and personal behavior and attitudes required of an entry-level practitioner. Providing objective, written, and oral evaluations to the EMS program, documenting the student's progress toward mastery of the overall objectives for EMT, AMT, and paramedic students, and completing the field internship objectives to assist in attainment of entry-level competency. Final field internship for paramedics. Paramedic students in PERCOM's program complete a final phase of EMS rotations called Final Field Internship, or FFI, which for PERCOM students is a minimum of 144 hours and at least 20 successful team leads. They are also required to have data to enter into Platinum Planner as well as hard copy paperwork for you to complete as a preceptor. The hard copy paperwork for FFI is mandatory, and it's quite a bit more than what they enter into Platinum Planner as data at this phase. The reason is that this phase is highly important, and your final evaluations on various aspects of their performance is necessary, and it's just not adequately covered in the data entry in Platinum Planner. Please refer to the posted objectives under the Objectives button if there is one, or wherever it's located on this page for more information. Preceptors must attest to the student's attainment of entry-level competency through completion of the Preceptor Statement of Entry-Level Competency. Please advise the EMS program of significant problems with student knowledge, skills, or personal behaviors and attitudes that require immediate intervention. Preceptors should work with the EMS program faculty in remediating student problems at any phase during rotations, and they should work with the EMS program in the ongoing evaluation and improvement of the program's curricula and instructional methodologies. Now on to requirements or qualifications of preceptors. We do require a current certification as a paramedic by the Texas Department of State Health Services for teaching paramedic students in the EMS environment. In the hospital, paramedics, RNs, physicians, respiratory therapists, CRNAs, and a few others may precept all student levels. Current medical control authorization is usually required from the medical director or the facility to precept. Completion of an orientation to hospital or EMS program field internship program policies and procedures for precepting of EMS students is required by most state licensing agencies and by both program and hospital accrediting bodies, and it should include Preceptor Roles, Responsibilities, and Requirements, internship philosophy, usually it's a competency-based approach in most schools, internship objectives and minimum requirements, operational policies and procedures, clinical teaching techniques, including procedures for dealing with unsatisfactory progress. All preceptors should complete this program and email the quiz or upload in Platinum Planner or by whatever method we give you for our clinical coordinator as evidence that you've completed the training. Be sure to print your name, sign the quiz, list the date you completed it, and also the service or hospital for whom you work on that quiz page so that we can credit you, and then you would be allowed to be a preceptor. General guidelines and instructions. Students will sign up for rotations through the clinical coordinator. The clinical coordinator or designee will notify the agency of the scheduling request. If approved, the student will be notified and will be allowed to attend the rotation. PERCOM students are not allowed or authorized to complete or attend unscheduled rotations. All scheduling must be done in coordination with our clinical coordinator and scheduled inside Platinum Planner. If a student is scheduled for a shift and fails to appear, please make a report to the clinical coordinator as soon as possible. Because several students may be assigned to a preceptor with one student at a time having priority, failure by one student to use scheduled rotation places several others at disadvantage. Students who consistently fail to show up for scheduled rotations are subject to disciplinary action. Be sure the student meets the dress code. Students not meeting this clinical dress code should be sent home immediately and reported to the clinical coordinator. Again, that dress code is a gray polo shirt with the PERCOM EMS Medical Education Consortium logo on it. All buttons on the uniform shirt should remain buttoned except the top collar button. The shirt should be cleaned, pressed, and tucked in at all times. They should be wearing navy or black slacks or uniform pants with a black belt. Fingernails should be clean. No fake artificial fingernails are permitted. Hair must be kept clean and tidy. Hair shall not extend below the collar line. So if it's long, whether it's male or female, and it's below the collar line, they need to comb it and fasten it up in a manner that keeps from interfering with patient care. They should also have good hygiene. We actually received a clinical shirt back in a Ziploc baggie. They returned it to us instead of keeping it. And it smelled so strongly of body odor that we had to throw the shirt away. Students shouldn't be in clinical rotations like that. If they come in with poor hygiene like that, they need to be sent away and we need to be contacted. They also should be wearing their student ID badge. It must be worn at all times during rotations. Texas law requires this. And even if they're rotating in another state, they're rotating underneath the preceptorship or the program directorship of a licensed Texas program. Black boots or shoes, no open-toe shoes, and no tennis shoes. No jewelry like earrings, necklaces, rings, except maybe wedding rings and bracelets. They shouldn't be wearing bracelets. No scrubs unless they're provided by the Department for Patient Care like an OR, and then they should be returned to you and they go leave again in uniform. Other required items such as stethoscopes, CPR mask and shield, watch with a second hand or display, and they can have some optional items of their own if they like a blood pressure cuff, pen light, scissors, etc. Other general guidelines and instructions. During the student's first shift, please provide an orientation to the unit including the chain of command, the station or department arrangement, routine, and duties. Students are expected to assist site personnel with routine duties. Explain the locations of equipment or supplies which the student may be asked to retrieve. The student should inventory the truck or department every shift to remain familiar with equipment locations. They should be oriented to the use of equipment such as radio systems as well. Should be oriented to special policies, procedures, or regulations, especially those that will affect student activities. But examples would include procedures for responding to calls or approaching patients, including procedures for use of seat belts in the mobile intensive care unit and for unrestrained movement when delivering patient care. Infection control, personal protective equipment procedures, no transport or refusal of transport procedures, patient dead on scene procedures, requesting additional units or supervisors. More examples for orientation to site may include discussion of, but are not limited to, the following: treatment of minors, treatment of crime victims, including sexual assault, crime scene operations and preservation of evidence, requesting assistance from or interacting with law enforcement or fire, routine paperwork, radio procedures, codes and signals, transfer of care at hospital procedures, and unit cleaning and restocking procedures. Also, they should be familiarized with the use of agency protocols. Students should be encouraged to study the protocols for the EMS service so that they can perform properly during the rotation. Emergency procedures and responsibilities should also be discussed at the beginning of the shift. Hospitals require that all personnel, including students, know what to do for specific emergencies. EMS services may also have emergency procedures for what to do if for in-station or on the unit emergencies. You should review the objectives for the rotation with the student. If you're unsure about what is expected or permitted, first ask them for a copy of their objectives. If they don't have them, contact the clinical coordinator. The objectives are designed to take the student from novice to entry-level competency over time, with abilities developing as the student moves through the rotation requirements. During your shifts with the student, try to review the history, diagnosis, complications, and treatment of each patient. Give case-specific comments that help correlate the student's didactic knowledge with patient assessment and management in the field setting. Provide opportunities for the student to perform assessments or procedures. During your shifts with the student, try to promote problem-solving skills by asking the student questions. Ask the student why the student chose a particular course of action. Never assume that just because the student is doing the right things or making the right decisions, that his or her reasoning is correct. Also, try to analyze patient problems to give the student an opportunity to see how practicing professionals think and reason. Explain why you did what you did. Or from time to time ask the student, why do you think we handled that call or problem or situation the way that we did? Provide the student with a brief critique following each patient contact or ambulance run that he or she completes with you. Supervise the students when they're performing activities. The preceptor should always review critically the student's technique and suggest corrections where appropriate. Students will ride on EMS rotations as a third person at all times on the ambulance and will always be under supervision when providing patient care, including final field internship. They're still under your supervision. Assist and evaluate the students until they meet the clinical internship objectives and perform as entry-level practitioners. At the completion of each shift, the student will ask you to provide them with a performance critique. Give the student feedback in each of the categories listed on the electronic or paper evaluation by comparing his or her performance to the performances defined in the rotation objectives. If you're unsure about how to evaluate a student, please contact the clinical coordinator. Your narrative comments are very important, especially if the student is not performing to standard or is not making progress. If you would prefer to discuss your observations with an EMS program faculty member, please call the clinical coordinator. Students must provide complete evaluation forms as part of the shift documentation, or the rotation will have to be repeated. Repeated failure to present complete evaluations may result in a student's dismissal from the program, so please help them do this. Students must document every run in which they participate using the forms in the clinical packet developed by the EMS programs. Documentation of all runs is important in assessing the quantity and quality of patient contacts during clinical rotations. As a teaching exercise, the student should be required to complete the run data before comparing it to the form completed by the EMS personnel. Do not allow the student to simply copy your chart. Stress to the student that patient names are not to appear in their reports. This constitutes a violation of HIPAA and most state confidentiality laws. Student documentation and paperwork. When all patient data is entered by the student into Platinum for the shift, the student will click to submit the data. A box may appear next for the preceptor to sign verifying attendance. After this point, the student should log out of Platinum Planner and allow you to log in and complete your evaluation of that student. If you don't have a Platinum account, you may use the tablet to create your own Platinum Preceptor account. Be sure to use the same email address you gave to the student at the beginning of the shift for the student to add you to the preceptor list in his or her documentation. As students progress through the rotations, they must demonstrate proficiency according to the class level that they're taking. This will include all skills required by the Department of State Health Services and national guidelines for the level of training. To successfully complete rotations, the student must satisfy all of the clinical objectives and satisfy all of the minimum requirements. Although these students are under your supervision, you are not expected to have to discipline them or tolerate any kind of unprofessional behavior. Please contact the clinical coordinator immediately if problems arise, especially if they're problems that you cannot manage. You are not required to work with a student who refuses to cooperate with you or who refuses to follow directions. Send them home. Contact the clinical coordinator. The ultimate criterion for determining whether a student completes the objectives should be the ability of the preceptor to answer yes to these questions. Would you be willing to work with this person as your partner on the MICU truck or as a member of the healthcare team in your department? Would you be willing to let this person treat a member of your family in a critical situation? By the time they get into final field internship and they're team leading these calls, your answers to these questions should be yes. And if they're not, then there could be a problem. Specific points for final field internship preceptors. Final field internship preceptors have a special role over and above the role of being an EMS experienced preceptor. This role requires skilled paramedic preceptors who can remove themselves from team leader role and allow the paramedic student to step into that role under the preceptor's watchful eyes and supervision. Students in FFI must run the call from start to finish, team lead the assessment, design treatment plans within the parameters of protocol and local standards of care, direct and/or implement the care, and perform proper handoff of the patient at the receiving facility. It should be expected that the student may not have memorized all specifics to your agency's particular protocols, so it is imperative that you, the preceptor, give feedback and guidance if any part of the treatment plan is not within those parameters and maintain that overall oversight. FFI students are not to write the agency's patient care report. However, they do have their own specific paperwork and narrative that they must write and enter into the database in platinumplanner.com. The FFI preceptor should review these documents for accuracy and assist the student in improving any noted documentation deficiencies prior to signing the paperwork or data approval in the system. Please do not simply allow the student to use your PCR to write their narratives. Part of the educational opportunity is allow the student to write his or her own narrative under the preceptor's tutelage and guidance. Preceptors will be required to document whether or not the student's overall performance for each call was at team leader level. Rating a student at 2 or below on any item for the call is not consistent with team leader level, so the call cannot be counted as successful if it's necessary to rate anything lower than 3. Definition of team leader per the Paramedic Clinical Manual available in this orientation website, which is based on the definition of team leader provided by our accrediting body. Per accreditation standards, for a team lead to count, the paramedic student's preceptor must grade it as a successful team lead, and the student must accompany the transport team to a higher level of care and function as team leader. This is usually transport to the hospital, but it could include transport to a landing zone to meet our medical if advanced level patient care was administered by the ground EMS team with the student as team leader. It could also include a resuscitation worked on scene with termination if an advanced or alternative airway and electrical or pharmacological interventions were administered with the student as team leader. Final determination of whether the call will count as a team lead rests with the clinical coordinator. If you have any questions or concerns about your role or responsibilities as a preceptor, data entry or preceptor evaluation processes, or about a specific student, please contact the clinical coordinator, Tammy Williams. If it's not an emergency, or it's out of business hours and it's not an emergency, you can email her at clinicalcoordinator@percomonline.com. If it is emergent, it just can't wait, her phone number for text message or telephone call is 903-407-1563. If Mrs. Williams cannot assist you or you have any difficulty contacting her and it's an emergency, or any difficulty emailing her and a few days goes by and you don't get a response, please feel free also to contact the Program Director, Jane Dinsmore. That's me. My email is programdirector@percomonline.com. My direct line phone is 325-267-6749. Thank you. Clinical preceptors are vital to the development of competent EMS personnel. Although students come to their rotation experiences with extensive classroom and then some in-hospital clinical preparation and then on to EMS, it's the experience in the healthcare setting which makes them competent entry-level practitioners. As a preceptor, you will have a greater impact on the student's effectiveness as a future colleague than anyone else the student works with during their educational experience. Thank you for agreeing to precept our students.